Assalamu alaikum. Hello everyone, welcome to Pharmacist Point. This is a very good news that pregnant women are now eligible for COVID-19 vaccination. So the Ministry of Health and Family Welfare of India has approved vaccination of pregnant women against COVID-19. So it's like the only armor which is available for pregnant women to protect themselves and their babies. So the important conditions are that it is really important that the healthcare provider or the vaccination provider should counsel pregnant women regarding the risk of exposure to COVID-19 infection as well as the risk and benefit of taking COVID-19 vaccination. So it's completely the choice of pregnant women to get vaccinated. And one more thing is that they can get vaccinated at any point of time. Currently, 3 vaccines are approved for pregnant women, that is Covaxin, Covishield and Sputnik 5, who are at higher risk of getting infected with COVID-19. So healthcare workers, of course, if pregnant women or lactating mother is a healthcare worker, she is at a high risk. Then community having high or increasing rate of COVID-19 infection. So now we all belong to such community with increasing rate of COVID-19 infection. And then people living in crowded household or people are always exposed to the outside world. So basically now we are at a stage that everyone should get vaccinated. Why is COVID-19 vaccine been recommended for pregnant women? So pregnant women are at increased risk for severe illness from COVID-19 and they're also having risk for preterm birth, that is their baby might be affected. So even neonatal death has been reported with COVID-19 infected mothers. Then their health completely deteriorates. Caution is better than cure. So at this point of time, this is the best decision for a pregnant woman, regardless if she is having any other problems, to get vaccinated. Then pregnant women with comorbidities. So this I'll explain soon. How does COVID-19 affect the health of a pregnant woman? So more than 90% of infected pregnant women, they recover without any hospitalization. Their symptoms are mild. We have cases where pregnant women with COVID-19 infection is having a risk of severe disease and death. So death has been reported. How does COVID-19 infection of pregnant women affect the baby? Again, in this case, 95% of newborns born from COVID positive mothers are at a good condition. But still, COVID-19 pregnancy has an increased chance of preterm birth, hospitalization and even death. Who are at high risk among pregnant women? So pregnant women with comorbidities, of course. So if they're at an advanced maternal age, pregnant women who are overweight, women with diabetes, organ transplant recipients, women with COPD, asthma, cystic fibrosis patients, sickle cell disease, women with advanced chronic kidney disease or receiving dialysis. If a pregnant woman has already had COVID-19, when should she be vaccinated? So she had COVID-19, we have to wait for the recovery. After that, she can be vaccinated after the delivery of the baby. Now, what are the side effects? So side effects are really mild fever, pain at injection site and body pain. Contraindications for vaccination in pregnancy. So contraindications, if the women has any anaphylactic or allergic reactions to previous dose of COVID-19 vaccine or previous vaccines, any vaccine, or to any components of the vaccine or injectable therapies or any drug allergy or food allergy. The vaccine is temporarily contraindicated in women with COVID-19 infection, women who are treated with any monoclonal antibodies or plasma therapy. What are the global recommendations? So the World Health Organization encouraged the use of recombinant vaccines in pregnant women. So vaccines from US, that is Pfizer, Moderna and we have Janssen. So these 3 vaccines trials have been conducted in pregnant women, but the data are limited. So the safety data published has reported some reactions. So regarding vaccines other than these 3, the data is insufficient, but based on in vitro studies and studies conducted on animal models, these vaccines are safe in pregnant women. And one important thing is that you don't need to do a pregnancy test before vaccination or delay pregnancy or terminate pregnancy because of vaccination. Never do this. And the RCOG also recommend that pregnant women should be offered vaccine same as the general population. Countries vaccinating pregnant women include Australia, Canada, Israel, Singapore, UK, and USA. So now we also have India in this list. And try to have a one-on-one conversation with your gynecologist or physician who is providing with vaccination. So right now, getting vaccinated is the best decision or is the best choice for you, regarding unless you're having any conditions which is mentioned in this video. Are based on the latest guidelines which was released on July 2nd. So if you want anything related to this, it's available in the description box. That's all for today. So just share this video with your friends or anybody who is pregnant, or your pharmacy friends or medical friends, anybody. So just share it. Make sure you subscribe to my channel if you like what I'm doing. And that's all. Have a nice day. Thank you.